Unfortunately, today, 1 in every 1,000 children is suffering from this dreadful problem called autism. Autism was described way back in 1943 by a scientist named Dr. Kanner. So what basically happens in autism is, it's a pervasive disorder as the medical world calls it, or it's also a part of global developmental disorder. So the development, even if it is there, is not in the right direction. It is completely perverted. So perversion means what? There is a complete incoordination between the mental activities, and there are a lot of symptoms that can tell you that your child is actually suffering from autism. So what are these things? And so I would like to enumerate some 7 or 8 points that can tell you that your child is actually suffering from autism, and they are here. The initial symptoms of autism start at about 2 years of age. That's the usual time when you will start seeing these different symptoms, or that your child is behaving a little different. The most important is that the eye-to-eye contact is lost. There is no eye-to-eye contact. The second thing is there is no separation anxiety in these children, which means that the children are not attached to their own parents. They do not attach themselves to their brothers, to their sisters. So the separation anxiety, once the children are taken away from their brothers, away from their own parents, there is no particular anxiety. They are very, very comfortable. So this can tell you that there may be an element of autism. Then, these children prefer to be alone. They prefer to play solitary games, and they do not want to be between their friends. They do not make friends easily, and they do not play social games. Also, their language and their verbal skills are totally absent or could be missing. It's very hard for them to catch up with words. It's almost impossible for them to make sentences, and they keep using the same mumbling words like mama, papa only, and they do not use words which require a higher level of intellect. Then there could be repeated actions like head banging, pinching themselves, also to the level of pinching their own genitals, rubbing their genitals, and most importantly, they are attached to inanimate objects than their own parents or their own siblings or their own friends. So these are some of the most important symptoms that can tell you, or most important signs which can tell you that yes, your child is autistic. So now the important question is, why does this problem occur, or what is the cause of this problem? Of course, it's very difficult to pinpoint one particular thing, but in my experience, I've seen more than 500 patients of autism all over the world, in India as well as in Europe, also in America. Stress during pregnancy in the mother was 50% of the times a positive finding. So the mother not being very mentally stable during her pregnancy, this could be because of an unwanted pregnancy, or she was forced to do an abortion that she did not want to do, or this could be some discords between the parents. The mother was not in the best frame of mind, she was not a happy mother during pregnancy, or some tiffs between the in-laws, or any kind of stressful situation for the mother. This was the most important cause. Also, I have seen in my experience that these newly proved vaccines can be a trigger for autism. Sometimes mercurial compounds are used, and that could lead to a disorder, although these things have to be yet proved, but then I've seen this in my experience. So while the mother is going through all this, I mean these severely stressful situations, what's interesting to know is how the adaptation process in nature occurs. Now, every child has his own intelligence, and he starts defending to these adverse conditions right in the womb. But unfortunately, these defenses are perverted, and the child does not develop as a normal child at the level of his mind and at the level of his body. So, in the conventional system, the kind of treatments autism are available for autism are not the best, because they are more on the suppressive way, because remedies are given so that the hyperactivity of the child can be suppressed or can be kept to normal, or they try to take care of the secondary effects of autism. So they are trying to handle complications, but the problem still remains. So if one has to actually cure this disease, he would have to go to the level of the child's DNA, and there he has to make corrections so that the disease can be cured, or the child can repair himself. This is what I call as the genetic repair process, or we have to stimulate the child's own genetic mechanism so that he will start repairing and hence curing himself. So how does one go about curing this particular disease or curing this particular patient suffering from autism? Now, there are three most important things. First is a good behavior therapy. The child must be sent to a good behavior therapist. Second is a good diet. Now, this is very interesting. Most of the children suffering from autism I have seen were having some kind of sensitivity towards casein and towards gluten. So avoiding these food products definitely are going to help your child. And the third thing is a good homeopathic remedy that can stimulate his own DNA repair mechanism. Now, what does a homeopath do till he comes to a point where he can prescribe a good repair mechanism process remedy? He has to understand the child in its whole extent. He has to understand the child's mind and the child's body. So most of the prescriptions that one makes are based on observation. We just have to leave the child alone in the own clinic. We have to observe what the child does. Does he pick up one particular type of a toy? Does he want to climb? Does he want to shout? Does he have some repetitive movements? So observation plays a key part so that we can actually come to the solution and we can come to a similimum, as we say. So once the similimum is administered, I have seen very, very good results in the first 3 months to 6 months, and then complete cure may be established in the first 2 years. Now, I have so many children suffering from autism who are today going to normal schools, and that's quite a thing. I mean, homeopathy has really been a very powerful tool in curbing this dreadful disorder. So all in all, the entire treatment is aimed at the child as a whole, for which one has to understand his genetic makeup in the sense of what are his natural preferences which are coming from his innate genetic characters, like what temperature does he prefer? Does he prefer the cooler ones, or does he prefer the warmer temperature? What are his eating habits? What are his preferences in food? I mean, some child may like sweets or some child may like sour. So all these are important for a homeopath to come up to a remedy. And once this remedy is given, the genetic reversal process starts and the child cures themselves.
Hi Sanjay.
Hello.
हां, मी अशोक मस्कर बोलते. 3 वर्षापूर्वी डॉक्टरांची माहिती ऐकल्यानंतर मी या क्लिनिकमध्ये आलो. तर आल्यावरती मला इथं खूप सहकार्य मिळालं. तर मुलीत माझ्या खूपच फरक पडला. अगोदर मी 15 दिवसाला 20 दिवसाला ॲलोपॅथी डॉक्टरांकडे जात होतो. सर्दीची ॲलर्जी होती तिला. नंतर मला काय 3 वर्षात परत त्यांच्याकडे जायची गरजच लागलेली नाही. आणि तिच्या नजरेमध्ये पण खूप फरक पडला आहे. बुद्धीमध्ये खूप फरक पडला आहे. चालण्या बोलण्यात खूपच प्रगती झाली आहे तिची. आम्ही अगोदर एवढा विश्वास नव्हता ठेवला की बाबा होमिओपॅथीमुळे की इतका फरक पडू शकेल म्हणून. ऐकून फक्त माहिती होतं की बाबा फरक पडतो, पण इतका फरक पडला डॉक्टरांमुळे ते विश्वास बसत नाही, इतका फरक पडला आहे. आणि ह्याच्या पैशाच्या बाबतीत पण त्यांनी खूप सहकार्य केलं आम्हाला. आमची परिस्थिती नसताना त्यांनी खूपच मदत केली आम्हाला. म्हणून आता 3 वर्ष झाले आम्ही त्यांच्याकडेच येतोय. बाकी आणखी 10 वर्ष, आता 12 वर्षाची मुलगी आहे. तर 8-9 वर्षात जेवढा फरक पडला नाही तेवढा 3 वर्षात फरक पडला आहे तिच्यात. ते बोलायचा प्रयत्न करते, चालायचा प्रयत्न करते. डोळ्यामध्ये तिची नजर कमी होते, तिच्या नजरेमध्ये पण फरक पडला आहे. आणि समज वाढली आहे तिची.
नमस्कार, माझं नाव अर्चना साखळीकर. माझा मुलगा आहे निहार साखळीकर. त्याचं 15 वर्षाचा आहे तो. आणि आता आम्ही 1.5-2 वर्ष झाले मी होमिओपॅथी औषध चालू आहे त्याचं. आणि सुरुवातीला त्याला त्याचा आय कॉन्टॅक्ट नव्हता. पेपर्स हवे तुला देणार आहे. आय कॉन्टॅक्ट नव्हता, बिहेवियर खूप होते. राईटला आणि मग स्ट्रेट. हां. आणि आता हां, आता तुम्ही बघताच आहे त्या होमिओपॅथी औषधामुळे स्पीच पण त्याचा आता डेव्हलप झाला आहे. सुरुवातीला स्पीच नव्हता, म्हणजे सेंटेन्सच यायचे नाही पूर्वी, एक वर्डच यायचा. आणि आता स्पीच आहे, स्पीचमध्ये इम्प्रूव्हमेंट आहे. बिहेवियर इश्यूमध्ये पण आहे इम्प्रूव्हमेंट. ही कॅन सीट ॲट अ प्लेस फॉर 1 hour 2 hour. आत्ताच मी एक फंक्शन अटेंड करून आले. टचवर तो 2 तास एका जागी चांगला बसला. आणि त्याच्या शाळेमध्ये ॲक्टिव्हिटीज त्या फॉलो करतोय. तर टीचर्स लोकांचं इन्स्ट्रक्शन फॉलो करतोय. आणि मेन औषधाचा आम्हाला काहीच साईड इफेक्ट नसतो या औषधाचा, होमिओपॅथी औषधांचा. पण थंड असतात ही औषधं, त्यामुळे या मुलांना द्यायला पण आम्हाला बरं वाटतं ते. आणि द्यायला सोपी पण असतात ही औषधं. आणि चेंजेस आहेत त्याच्यामध्ये, बरेच चेंजेस आहेत.
After all, it's homeopathy, the science of tomorrow that betters your life today.